this was just in last night's paper, talking about being able to afford health care. And I'll just throw out a statistic that's later in this presentation. The administrative end of this number is between 90 and 190 billion dollars. Within that number, we would be able to pay for health care for every person in this country to insure them. This report was done by the Institute of Medicine, and it says, report, healthcare system wastes $750 billion each and every year. And we can't afford to pay for health care for all. Roughly 30 cents of every medical dollar spent in this country is wasted. Now I do have to close out to at least get a connection. Now what did I do? I'm trying to get down far. That one. Now, what we've been talking about so far, does that sound like the way of Jesus? Does it taste like Jesus? You know, we've been walking through this Sermon on the Mount, the teachings of Jesus, and what Jesus did. You know, heal the sick. When he healed somebody, he said, I can't do this for you today because you didn't bring your copay with you. Oh, I'm sorry, you don't have insurance. We can't do anything for you. Feed the hungry, clothe the naked, shelter the homeless, compassion for neighbor. One of the things is challenge unjust systems. However, I can say this, there is a price to pay. When you challenge a system like healthcare, whether you're in the system, because many people working in the system are just as caught by the system as people outside. I was acting as a patient advocate for my daughter, and not through my doing, but she was going to be seen by the GP or family doctor that I have. And the doctor said they would call back within about a week. That was on July 31st. On August 14th, I wrote a letter which my intent was to convey the time constraints that my daughter is under because of FMLA and what the impact of the system has on her. About the middle of around the 23rd, 24th, we both get a certified letter. It says, both of us now no longer have a family doctor. Luckily, my daughter called that day and her GP she was switching from had a cancellation on the following Monday. So she is covered by a general practitioner. The part that was the most troubling was the fact that when on FMLA you have paperwork that you got to fill out each month. Otherwise, well, yeah, it has to be submitted to the employer because after 12 weeks they have to hold your job. They have to hold a similar job open for 6 months. But you got to dot the I's and cross the T's. And also on your temporary disability policy, that paperwork has to be filled out. And if you don't get that in, if you're trying to survive on your temporary disability, paying $487 a month for COBRA coverage on $1,200 a month that's coming in, it doesn't happen very well. And if that paperwork is delayed, they only pay out twice a month. And if that paperwork is missed. I had somebody at a health system tell me, well, that's just the way it works for people that are on temporary disability. This was a customer service representative at a healthcare facility. That is the capacity. But again, on the first side, they also are stuck in this system. Healthcare as a basic human right, recognizing its own, and it may take years, would be the change necessary to be able to move this system in a more humanitarian and faith and Christian way of treating people.
What are your solutions?
Tune in next week?
Yeah. Yeah. Tune in next week. There has to be a conversation. There has to be conversations in every little burg and county. You have to develop a groundswell of opinion. That's why I say the first step is to get health care declared as a human right in this country, because it changes the dynamic of the arguments from that point on. So,
Well,
amen.
amen. And I think our intent is to give Wayne a number of weeks to be able, so we can really get it. This is not a one Sunday thing. And that's the time where we can actually reflect together too.